Hello and welcome to the NDARC weekly webinar. My name's Bianca Varney and I'm today's chair. Today we are hearing from Peter Gates. Pete's current research is focused on the NDARC Workplan areas relating to prevention and early intervention in communities and families. Pete leads a program of research intended to reduce the harms from alcohol and other drugs in rural and remote communities of New South Wales. This work involves co-design and building upon existing community strengths to bring together community concerns and research evidence. To aid in connecting with existing community-led efforts to reduce harms, Pete has developed relationships with local and community drug action teams, as well as the Mid-North Coast local area health districts and New South Wales Health Vaping Taskforce. Pete has completed several reviews on the impact of community action on alcohol and other drug use and harms. Today, Pete will be talking on community action to reduce alcohol and other drug harms, where we are now and lessons learned. We have Mel Ricketts here to help discuss this work. Mel leads the tobacco and e-cigarette portfolio for the Mid-North Coast Local Health District Health Promotion Team, where she has worked for the past 8 years. As a tobacco treatment specialist with a diploma in alcohol and other drugs, Mel was instrumental in developing the North Coast Youth Vaping Taskforce and has led multiple community-driven projects. Mel is in the final stages of completing a Bachelor of Public Health with a strong focus on prevention, health equity, and supporting communities to live healthier lives. So we have a slightly different format than usual today, where both Pete and Mel will be presenting together with a slightly longer presentation, and therefore we'll forego the final panelist reflections after the presentation and go straight to the Q&A. To make most of our time with our panel, we'll be taking questions through the Q&A function. Please feel free to pop any questions into the Q&A box, and we'll do our best to get through as many as possible. Before we begin, I would like to pay our respects to the traditional custodians of the lands on which we meet today. I acknowledge that I'm joining from the lands of the Bidjigal people, and I honour their elders past and present, as well as emerging leaders. Now, I'm delighted to introduce our speakers on this important topic. Pete and Mel, would you both like to turn on your camera and mic and start presenting?
Thank you, Bianca. I'm really excited to get started with this presentation. I think it's really important to motivate conversation around community action, just because it's an area that lacks a lot of clarity. A lot of clarity around what it is, even whether it works, how to go about it. We're going to try and touch on as much as we can. And I'm super excited to be joined by Mel, who gives us a stellar example of community action that has worked. So let's make sure my thing works. Yes, I'd just like to also acknowledge the traditional custodians of the lands we're all coming from. For me, it's the lands of the Gundagara people. And I'd also just like to recognise the strong connection to community of our First Nations people. So who am I? Hi, Dr. Peter Gates. Just a quick background. Started work at NDARC in 2001, looking at treatments and how to evaluate treatments for cannabis use disorder. Then I started working with the National Cannabis Prevention and Information Centre when it started in 2008. I did my PhD there, developing counselling sessions that were delivered over telephone. The Cannabis Information Helpline, some of you might be aware of it. But when NCPIC was unfortunately defunded due to a change in political climate around cannabis use, I moved to look at illicit drugs for a while until I came back to NDARC, started working with the Sustain program and looking at community action. And I'm going to take you through my research journey there. So I have gone through over 90 reviews of community action. I've looked at all of the primary studies involved, hundreds of them, on community action, and I've spoken with a number of people involved, stakeholders in community action, including Mel herself, who can now introduce herself.
Hi, thanks Pete. And firstly, I'm presenting from Gumbaynggirr country, so I'd like to pay my respects to elders past, present, and emerging, and live in a beautiful environment. Also, thanks to Pete and NDARC for inviting me to be a part of this webinar today. It's really exciting to be able to share my insights on working in the community and especially a community project like the North Coast Youth Vaping Taskforce, which has been a collaborative between the health promotion team and public health teams across the Mid-North Coast and Northern New South Wales local health districts. So I've been working in this space for the last 8 years, been in a combination of policy role, but also now with health promotion, leading the tobacco and e-cigarette portfolio for the Mid-North Coast local health district. A huge part of both of these roles has been consultation, so identifying areas of action, bringing together key stakeholders to address these actions. And with the emergence of vaping concerns, particularly regarding young people, it's led to an opportunity for us to broaden our scope and reach, which has brought on lots of opportunities and learnings, and some of which I'll share in today's presentation. And just to highlight that none of this work is done in isolation. There's a huge team of colleagues, stakeholders who work across the North Coast to address youth vaping in our region. Thanks, Pete.
Thank you, Mel. Okay, so to start my research journey, I was faced with the question of what community action is. And I was looking briefly into definitions of community. There was some consistency in definitions in that it was either a shared place or that it involved people with shared characteristics. But I quickly found a problem there that was a really broad definition. It didn't really tell me what community was. And just to illustrate that here, I can, in the picture, you can see the students there could be considered a community, but so could be the yellow shirt wearing students, but also so could the entire world. So there was an issue here that we needed to explore further. And I was also aware of some strategic documents that prioritized involving communities and community action. So we've got the Global Alcohol Action Plan, for example, for the World Health Organization, our own National Drug Strategy. I was really chuffed to be invited to the Drug Summit last year, which has also now produced a report and it has been responded to by the government. And so I was interested in these sorts of guiding documents to provide some guidance around community action. So in the World Health Organization's Alcohol Action Plan, yes, community action is prioritized. It's 3 of 10 actions there that have been prioritized, but what is it? There's no more information there except that it involves community-based programs and coalitions. Similar picture in the National Drug Strategy. They support community engagement, involving community, and that it involves partnerships, collaboration, but anything further than that, not sure. I did a word cloud search on the Drug Summit report, and I was pleased to see that community came up quite a bit in the report, and that we were presented with a little bit more details of what it might mean. It's a similar thing here, though, where it's talking about place-based programs, so the partnerships, the coalitions, and as I said, it's been responded to from the government now. The New South Wales government has provided support in principle and support for these programs, community engagement, but further detail than that is not provided in these guidance documents. So my journey started with what was provided, which was that community action appears to be the work of coalitions, so partnerships. So specifically, the coordinated collaboration between formal and informal organizations that are looking to reduce or prevent alcohol and other drug use. So I was investigating what makes for good coalitions and how they might work best. I found that in Australia, at least, coalitions would typically involve one of these 4 organizations, usually not all 4, usually health promotion, and that there were some missing partners. So it became apparent to me that, for example, there was missing local government representation, and there was missing, in particular, I noted missing research partners, people with research experience involved in coalitions. And so looking into coalitions a little bit further, discovered that coalitions are very difficult to form. So there's some research that was showing, I forget the methodology of the research, but it was about 80% fail before they get started. And a lot of that is to do with the communities that they're in. So there needs to be a lot of community readiness, but also if you're looking at areas like rural and remote areas, they may not even have the existing partners for the coalitions. So it depends a lot on the community itself. And so I was looking into what makes an effective coalition, and that is really synonymous with effective leadership. And so what makes an effective leader is someone who's good at planning, succession planning included there, good at helping people feel heard, making sure that people understand their roles and their responsibilities, and that the people who are involved have a shared mission, that their normal day-to-day work aligns well with the goals of the coalition, and that the leader should have some kind of authority or power so that they can actually do the things. So if in the coalition it was decided that this activity would be good, it's important to be able to then say, yes, that is good, here's the money to do the thing, rather than saying I need to speak to my supervisor. And so I'd like to invite Mel to talk a little bit about the task force.
Yeah, so when we came to forming the task force, there was a lot of enthusiasm for people to share what their stories were and providing their insights at a ground level, which was fantastic. But then when it came to translating this into action, it was a little bit difficult to find traction. So again, if those organisations, it wasn't a priority for those organisations, it was really hard to get that buy-in, which, you know, is only fair. So they could see the impact that it was having in the community, and they wanted to have support and be able to, you know, provide input, but they didn't have the commitment, I guess, to provide that ongoing input. So one way of working with this barrier was actually generating outcomes that were easy to be shared, but still address some of those underlying issues. So for example, lack of awareness and knowledge. So to address this, we looked at a strategy around emerging the development of a North Coast Youth Vaping Taskforce hub. So we could put all the information in the one space that was really easy for people to navigate to and to use. And then creating newsletters and sending those resources out that allowed our partners to contribute without feeling overwhelmed. So it's just trying to find those balancing acts where people feel like they could support, but without being sort of burdensome. Thanks, Pete.
Right. So that's a lot of talk about coalitions, but not a lot of talk about what the coalitions do, what the actual action part is. So I was revisiting the definition on community. At this stage, I had now read the hundreds of articles on community action and the sorts of things, the sorts of communities that were involved. And it really boiled down to mostly the postcode or the LHD level, but that it was really specific groups within those postcodes that were targeted. So it was either adults, youths, or at-risk populations, and most typically youths, and the youths that were teenagers. And so even that summary of community is a little bit more succinct, but it's just too hard to define. So I would say, you know, when you're talking about community, it's up to you to describe what community is to you, and inviting Mel to do that.
So to me, community is not just a group of people living in the same place. It's a dynamic network of people, relationships, shared spaces, and a common purpose that creates a sense of belonging and collective identity. So from our older adults and our elders to our youth and our, you know, different backgrounds in our community, this brings a shared value concerning the current issues in our community and how they impact the community as a whole. We also need to look at, you know, what our hopes and dreams are for the community, and what does the community want us to invest in, you know, invest our time in. You know, particularly being a government organisation, we need to be ensuring that the outputs that we do are actually, you know, leading to what community want us to address. And lastly, it's the environment. It's a sense of place, an emotional and cultural connection to this land, and making sure that we protect it. Thanks, Pete.
Yeah, it would have been good if that was, you know, written down for me somewhere where I first started looking into community, because that's a great definition. Okay, so what do the coalitions do? So I did spend a lot of time looking at all of the activities that have been involved in community action, and I did categorize them. I'm not going to go into that in detail here. I just invite you to contact me if you want a copy of a publication that I've done on that. But just to say that there's almost infinite activities. But a big focus, at least in Australia, in community action, would be on mobilisation and involving probably more the schools. But we have Mel to talk about her example of community action and what is involved with the task force.
So the community consultation, including the community forum that was held, were pivotal to developing our action plan. So all the insights that were gathered over nearly 6 months was put through a thematic analysis process. We were able to sort of extract the key themes that were, main of concern in our community. To assist with the distribution of actions at an organisational level, we decided to break the action plan into 4 key areas. So schools, community, health, regulation and environment. And this allowed organisations to really easily identify where they fit in and what they were able to sort of action. And some of the actions that we've done to date is the developing of the North Coast Youth Vaping Hub, which I've already spoken about. We collaborated with Health Pathways to develop the first statewide pathway to assist practitioners navigating vaping with youth and their families. We work with our HEAL team within the health promotion team to share resources to schools, including newsletter snippets, etc. We've been able to pilot an in-school program. We've been doing ongoing mini forums where we'll pop up in some of our smaller regional towns to have that, share that information sort of from a top-down approach to make sure that the community are hearing what's happening, but it also gives us an opportunity to hear from the ground up what's the local concerns are, and that's been really invaluable to make sure that we keep on top of what's happening. We've created a self-directed learning module. So this is for youth workers to be able to do brief intervention with young people who come to their service. We've been partnering with our local Tackling Indigenous Smoking team. We've received a grant from the Cancer Institute to work with our youth organisations to create local resources. So these are the great caps and t-shirts that are in this image. And we continue to work with schools to make sure we consult and learn from students, and developing really strong partnerships with organisations who work directly with young people. So, for example, Headspace, to name a few. Thanks, Pete.
Yeah, okay. So I'm just going to go through now what I found in the research. Regardless of what activities are involved, what I found would be predictors of success or failure. And so just to start with, a really simple one is to have a plan. And so I actually have a specific plan or method of planning in mind here called a program logic. And what that involves is really having an understanding of what activity you selected might work, the mechanisms for change, but also looking at what outcomes you could collect to show whether or not it worked. I'm trying to do a full circle plan here, and luckily we have Mel, who's an excellent planner, to demonstrate that.
So I guess at first developing a program logic felt like a really huge task. There were so many moving parts to addressing youth vaping and making sure that we had a really broad reach of the work that we were doing. So there's so many moving parts, from stakeholder engagement to resource development to evaluation measures and implementation planning. So it required really stepping back and seeing how each component connected to the overall goal, and understanding what resources we already had available to us and what we needed to, uncover, and also who to consult with. This is only a real snippet of our program logic, but as you can see, there was a lot to consider. Thanks, Pete.
Yeah, okay. And so here's my favorite part, is exploring the evidence. So when you're selecting an activity, it's really important to have an understanding of the evidence that might support that activity. There is some research to show that just leaving communities up to do what they think is best isn't necessarily the best idea. And so I'm going to explore a little bit now about the evidence around activities. And just to start by saying that, just to acknowledge really that evaluating community level activities is very difficult. It's a highly resource intensive activity. And it's difficult in the sense that it's what you're looking at is comprehensive. So it's multiple activities. And it's very difficult to tease apart whether if what you did worked, was it that combination of activities that worked, or was it maybe a specific activity within them that worked? And that's very difficult to tell. And so unfortunately, the answer is that there's a lot of mixed impact, depends on what you did. But what's consistent, even among the evaluations that have the answer that what they did didn't work, so is that whatever you do, it has the added benefit of community empowerment. And by that, I mean really building the capacity. So what you did required that coalition to be formed. It required you to have that networking and the capacity to do what you did. Maybe it didn't work, but now you're in a better place to do something next time. And also just to recognize that communities really respect that they can have ownership over those activities and accountability. So there is a little bit of clarity in the impact research. Some combinations of activities that work better than others. So school programs that involve families that build the community, the wider school community, have probably the greatest, the highest quality of research as well as impact. And so we can put that at the top of the list. Then studies that would involve vendors and responsible service training that was also enforced by police, had a bit of consistent impact. If you were to raise awareness or provide information, education, one thing to avoid is just a factual approach. So like drugs are this, drugs do this, but rather to focus on referrals to services and support in places that you can go for more information. And finally, whatever you do, it'd be better if you had a media campaign, but I have to acknowledge that that's very resource intensive and out of scope for most people. But there is consistent support for involving media. Just to recognize also that policy works. So the World Health Organization's best buys, there's a ton of evidence to show that these are effective actions to take for a community. However, I do have the four-leaf clover there to remind me that the government level, as I said, is often not involved in community action. And so probably the best that you're left with is advocating for these policies. So good luck is the four-leaf clover there. And I'm just excited to share this, take this opportunity to share this practical piece of work that we're focused on at the moment. We're putting together this central location where community members can go to get this information on what works in community. And so we're providing this online resource that has a selection of activities, and if you select one, you can instantly see a visual representation of whether or not it might work for the different drug types, and as well follow links towards the evaluation studies that were relevant, and also information on why it worked. So if this sort of thing interests you, please reach out to me and we can talk more about that, because it's something that I'm working on currently. And so we have Mel for her practical examples of what worked for her.
So for the task force, the community consultation was, absolutely pivotal to engaging our local community and understanding what our community needs were. So consultation was done with a broad range of stakeholders, including youth, parents, teachers, school staff, and just the wider community in general. We did this with various formats just to allow for participation. So including attending youth reference groups, running online forums. We attended a lot of community events. We had a community survey that was shared online using social media, and also a formal forum setting as well. So this allowed for us to get really clear, strong insights of the community concerns and the needs. And at the end of this, we were able to look at what the priority areas would be. So we have prioritised ongoing engagement with youth and hard to reach young people as a really important process, making sure that their needs are met. And this is where partnering with those youth organisations ensures that we can speak to youth where they are versus them needing to come to us. Thanks, Pete.
Thank you. Okay, and so one of the important elements for success with the coalition, as well as in community action in general, is the breadth of membership. So can you have the schools and the police involved? And the more people that you have involved, the more resources that you have involved, because you'll need that in kind. Because prevention is just generally not well funded. So we've mentioned the things like the community drug action teams and the local drug action teams in Australia. They operate on annual funding cycles of up, around $10,000. It's not a lot of money, but if you can, is to focus on the breadth of membership so that you can bring in that in kind. We'll hear about funding for Mel.
So this project was really delivered as part of our business as usual, and really highlighted how much could actually be done with limited resources. Rather than actually receiving direct project funding, we have been able to support and advocate for some of our local NGOs to apply for small grants so they could carry out some of those actions associated with the task force. This has really meant a difference in the strength of our team and the collaboration and trust and that shared purpose across agencies. And that teamwork has brought the project to life, and it provides that strong partnership and a united vision across our whole community that can deliver big outcomes without needing a huge budget. Of course, funding would have helped increase what we've been able to achieve. So it's only a given. Thanks, Pete.
Yes. Okay, and so another thing to be aware of is when you approach a community, and for example, if you have this research that shows, okay, excessive alcohol use is bad. This is a concern. And you go to the community and you'll find a lot of variation in the ways that community and the concerns that communities have. So they might not be agreeing with you that alcohol use is a concern. And so one thing that you'll need to do is to use local data to raise awareness of and to show that these are the concerns of the community in order to foster support for the activities and to get people on the same page that, oh, yes, alcohol use is a concern for our community. This was something that was very important to Mel. I know. I'll let you go into that. Thanks.
So yeah, during our consultations, we uncovered limited awareness and really mixed understandings around the harms associated with vaping. So early discussions highlighted widespread misconceptions that vaping was harmless or, a good alternative to smoking, particularly with young people and their parents. So in response, the task force prioritised education awareness, sort of raising the initial core actions being, creating that pathway for evidence-based resources, making sure they're shared to all our schools and youth services, and just making sure that information that's shared across our community is consistent and that information to young people was evident, that mixed messages allowed for uncertainty. So we really wanted to make sure that we had that clear knowledge across the whole community. So that was a really pivotal thing that we found in that consultation process.
Yes, and also just to touch on that whatever you might do would hopefully have some kind of scientific justification. Theory is important. There's a couple of main theories around community action that you might want to be aware of. So I've already touched on a little bit with the theory of community empowerment. So it's just looking at ways to enhance a community's control over societal and structural change. And also diffusion of innovation theory, which is just looking at how ideas are taken on. And so it focuses on things like involving community champions and also reaching this sort of pivotal level of around 10% of a community to be on board with something for it to diffuse. I was just thinking of this example of the community champions and the success there. I read this news article of Taylor Swift. It's not entirely relevant, but I just saw that she just wore this T-shirt that had some otters on it. And in 2 weeks' time, the otter problem was solved. And so just to focus on involving community champions can be very successful. But just the idea that in order for an idea to take, you do need a base level. And also, I haven't really focused a lot about how community action itself is focused in community and not individuals. So before the late 80s, the big focus was on individuals, but then people started to realize that drug use occurs within communities, it impacts those communities, the communities impact the drug use. And one of the pillars of prevention work is to understand the risk and protective factors of the community, and also to engage with the community to understand those. And again, I know that was something that was very important for me.
Yeah, we really wanted to make sure that everyone in the community had an opportunity to contribute. And so we created multiple avenues for people to be able to provide that information to us. So empowering the community to participate, we saw opportunities to connect where people were. So as I mentioned before, attending those community events and engaging with community directly, that was definitely one way we were able to engage with a lot of parents. Collaborating with local organisations who have trusted relationships with the target community to really strengthen that reach and participation. Creating accessible engagement spaces. So we held the face-to-face, but also online gatherings where people would be able to voice their opinions. Having an online survey, which allowed the community members could share their inputs in their own time. They didn't need to attend an event or an online session. And I guess most importantly, we invited all those participants to continue their involvement by joining the formal working groups of the task force, looking at the established findings and then turning that community feedback into a community-led action plan. Thanks, Pete.
Yeah, okay, so here's an overview of the sort of cycle of community action, where we engage with the community to understand their priorities and concerns. We choose the activities, hopefully using evidence. We implement them, then we evaluate them, and we revise and reapply what we did. This is the ideal. In reality, in Australia at least, we're very good at the community concerns and choosing the activities and doing the activities, but less focus on evaluation. And that's just because I've already mentioned evaluation is difficult. It's not really something that people are generally aware of in terms of what makes good evaluation. And in terms of the revise and reapply, it kind of gets across here because just of the model of prevention being on annual cycles, it kind of hinders the ability to build towards something over multiple years, to revise what you did and reapply. Not to say that it doesn't happen, it's just I just didn't give it a big green tick because it's something that we can work on. But in terms of evaluation, I'm a researcher, so that's really important to me. And because of the fact that it got this cross, I wanted to focus on it a little bit here. Now, I recognize that we've got a lot of viewers listening to me, and there'll be different levels of expertise with evaluation. I'm just going to do a real first aid course on evaluation, cover the basics. You might already be familiar with them, but these are the points that I want everybody to be aware of, especially those involved in community action. So firstly, you want to be sure that the people that you are using as part of your evaluation represent the community that you're targeting. And so that can involve, things like power analyses and stuff, but it's just something to be generally aware of, that if you're targeting the youth in the community, then you want to find a way, obviously, to involve the youths. And in terms of the involvement of participants, things like informed consent are important, but also you want to avoid coercion. So if, for example, you have a stall at a community event, you wanted to invite people to do your survey, and you wave some candy in their face, you probably should avoid that because it might introduce bias. Most important is to establish a baseline. So if you're just asking people what they thought of an activity after the activity, that's going to be introducing very significant biases, but also it just might be incorrect. And involving a baseline allows for statistical analyses and also to look at individual differences within the groups involved. I recognize that involving a control group when you're looking at a whole community can be very difficult. And this is one of the downfalls of the whole field. It's unfortunate, though, that having a control group is very important to really demonstrate that the change that you identified was due to the activity and not something else. And having a control group is the best way to do that. And there are many examples at the community level of this done successfully. It's fairly resource intensive. In terms of allocation of participants to groups, ideally, you want to aim for a randomization in that allocation and to enhance things like participant blinding. So looking for ways to involve data collection with participants that weren't actually aware that the data was that they had participated in the activity or that was what the data was for. And blinding of the people making those assessments as well. This is a big one, looking at valid and reliable measures. So I'm not going to focus on what validity and reliability is, but just as a starting point, a good way to start would be to use tools that have names, for example. So things like the audit you might be familiar with. Because what we want to do is promote consistency in the way that the activities are evaluated. So just to highlight an example of this, say we're in two communities and we did the same activities. And in my community, and we were interested in looking at alcohol use. We were addressing concerns with alcohol. In my community, in my evaluation, I looked at doing a timeline follow back, looking at the proportion of participants that use more than 6 standard drinks in so many occasions. And you were asking whether or not they'd used alcohol in their lifetime. We have a problem here. And so it's not because what I did is better, although it is a good thing to do, a timeline follow back method. It's a way of enhancing the accurate recall, etc. But ignoring that, the problem is in comparability, because we'll have a murky picture here of whether this activity was generalizable. Did it? Because we can't say that it had the same effect in the two communities. And also, if you're looking at harm, and especially harm related to substances, the tricky thing is to show that the harm that you're evaluating was caused by the substance. And I'd recommend using things like routinely collected data to address that. So for example, looking at crime data, because police do things like biovalidation, or looking at hospital admissions, because in the hospitals they have the doctors that have their own standardized procedures to establish that the harm was caused by the substance. Okay, and when you're looking at multiple activities, comprehensive activities that are delivered in multiple locations, you need to have some kind of measure that what was delivered was what you intended to be delivered. So did it go as intended? And that way, when you show the change was due to the activity, you can also show that the activity was what you said it was. And looking at confounds. So being aware of things like if the evaluation is going over some time, confounds might include even things like secular trends where drug use fluctuates over time. But also like variation within the community. So having people of different levels of education, difference in genders, and what other confounds can I think on the top of my head? Oh, and also the other things that are happening within the community. So because you're looking at this broad level and over time, there's going to be a number of things that might impact the community that might be responsible for that change that you should be aware of. And there are plenty of examples actually of where, for example, the alcohol industry became aware of activities and just really ramped up things like their marketing and to tread on the activities that were going on in the community action. And so you need to be aware of the other things that are involved. Okay, so my last slide here is just to talk about the difference between outcomes when you're doing an evaluation. There's process outcomes. They show that what you did, what you said you would do, as I mentioned, and there's impact outcomes. And what is generally the case in community action, in Australia at least, is that they're very good at showing these things that have ticks. So we're good at showing increased awareness and knowledge, and that we did what we said we would do. But you should be aware that if you want funding for community action, policymakers are actually more interested in these things, in consumption and harm and proxy indicators of consumptions and harm. So you want to do your best to include those factors. And that's a whirlwind tour of evaluation, and I'm going to end with Mel to give her experience with it.
Thanks, Pete. So in my experience over the years, evaluation is often an afterthought. When it really comes to project planning, it should be, you know, in the early stages and an integral part of program design or project design. In previous projects, evaluation surveys responses have normally been really low, like around 20% response rate. And for the task force evaluation, we decided to conduct phone interviews for each person who attended our forums. So while this was kind of time and resource intensive, we actually felt the project was complex and required that flexible questioning to allow for a deeper understanding of the participants' insights. So additionally, it created an opportunity to continue to build the relationships that we had started to create or had already created over the years with these stakeholders. So it's really sort of integral to keep building on these relationships. So we developed a set of mixed method questions, which we asked all participants to respond to. So we had some open-ended questions and then also some scale rating questions. We recorded all this feedback, which meant that the feedback received was really of high quality, and it provided the working group with a clear insight into participants' thoughts and feelings about the work that we were undertaking. And finally, as part of the evaluation questions, we were able to ask the participants how they wanted to engage with the task force moving forward. So as we progressed, you know, would they like updates or would they actually like to be part of the formal kind of working group task force work? Some chose to join the formal working groups, while others only wanted to receive updates of their actions as they progress. So it was really good to be able to tailor that feedback to the individual and, you know, not overwhelming those participants who have given us so much that, you know, we could tailor what they wanted. So if they wanted to join the task force, that was great. And if they just wanted to receive updates and sort of further information, that was great as well. So it was a really good way to actually make sure that our participants actually got what they wanted at the end. Thanks, Pete.
And thanks, Mel. So that brings us to the end of this presentation. Thanks, Bianca, if you're about.
I'm here. Thank you so much, both Pete and Mel. I think we can all agree that was absolutely fantastic and also nice to bounce between you and get the different perspectives. I will jump into some questions because we do have a few. The first one, this is for you, Pete. Will the evidence-based response resource have recommendations for evaluation tools?
Yes, absolutely. So as you might have picked up on the talk, evaluation is something that I'm very keen on promoting. And yeah, we're developing that tool currently, and one of the presenting, like the facing page to it, will guide you into things like the program logic, how to do the program logic, selecting the outcomes and things to be aware of in terms of the evaluation, how to conduct evaluation. So yes is the answer to that question. And if you are keen on it, again, I invite you to email me so we can talk more about it, because I am developing it currently.
That's amazing. Thank you. And I imagine, yeah, having that tool would be so helpful to plan from the beginning of your project. Sounds like it could be quite important. The next question is, how well do current funding models support grassroots AOD prevention and harm reduction work? Leave that for both of you, I think.
Yeah, well, we're both aware of how not well. So I could just say, to begin, to highlight at least the ratio of the drug budget for prevention, just to start there. You may not be aware, but it's around 6% of the budget. And so when it comes down to the support that things like the local drug action teams and the CDATs get, the community drug action teams, it's filtered down to you know, not a whole lot. So you know, there's a number of recommendations that could be made around that. The main one being, let's have some more money, please. So the drug summit highlighted there, you know, we were very lucky to have Carmel involved, who's heavily invested in community action, and in terms of the report and the chairing the drug summit, and the response from the government being, you know, in support of redesign. So there's scope there for some change. But I guess the main point is that there's just not a lot of money to go around. So yes, and Mel, perhaps you have that same experience.
Yeah, and I also think we have a lot of organizations and departments working in silos that we could actually all coordinate efforts together. I think we would be a lot stronger. Where I'm a member of one of our local CDATs, and I think we see this opportunity to actually bring all those organizations together to work with our community and build on the strengths that we all bring, versus trying to work in our sort of our own lanes. So I think there's a really big opportunity to actually work more collaboratively. I think would be wonderful.
Excellent. And you mentioned that you got funding through some NGOs. Was that your initial plan, Mel, or was that because it was a bit harder to get government funding?
So really just supporting other NGOs to get that funding and do the work on their, themselves. So we would then advocate for them and sort of, you know, provide support for that funding where we weren't able to actually sort of undertake those roles.
Yeah. Next question we've got, what are the biggest lessons learned from the past community-driven AOD programs that failed or struggled to sustain outcomes? Once again, I feel like you could both give very different perspectives on this, so I'd love to hear from both of you.
I think funding turnover, like funding cycles, really, you know, challenge community to really build trust and relationships in community. So a really great program might get some great funding and it'll be there for, you know, 3 or 4 years, and then the funding runs out, and the trust in community, especially a small community like I live in, is, you know, people build that relationships with an organization, and then the funding gets pulled, then they're back to square one again, and they need to retell their story again, and there's a lot of trauma involved with that. So I think that ongoing funding is really important, and being able to, you know, maintain that connection with community and not let people fall through the loops.
Yeah, and I'll just add, in terms of the research side, there's you need to basically be a researcher to get an understanding of the evaluations that have been conducted in the field to work out what works, because the CDATs and others, they do their evaluations, but there's and this is why I'm working on the tool that I mentioned, there's not really a central place that you can go where you get the information of what people have done and whether it worked for them. So there's a lot of opportunity for people communities to not operate in silos and to work together. And it's not to say that that doesn't happen. There's just more opportunity for that. Yeah, in terms of involving researchers to assist with the evaluation side, because yeah, it's just not something that comes naturally. You do need training in it, and yeah, so it would be great to be more involved in that way as well.
Yeah, amazing. Sounds like connections are pretty important key for success. What emerging challenges, and I've got some examples for vaping, prescription misuse, synthetic drugs, are communities least prepared for? Mel, do you want to speak to this?
Yeah, I think at the moment we're just really challenged with the illegal market and people still accessing that versus going through a pharmacy model. Yeah, it's a bit of a tricky one where it'll be interesting to see over the next little while with changes, you know, to policy and legislation. And yeah, I think that's a really tough one. I probably can't really answer that very well.
That's all good. Pete, do you have anything to add from what you've seen?
Mel is the expert here, but it's just that it's a rapidly changing you know, area with the regulations being brought in, and the fact that there's a real lack of awareness and knowledge in particular around the harms from vaping, and that's because there's a lack of research and longitudinal study of the harms of vaping, etc. But we could talk for hours about vaping. Let's not do that.
I guess it's hard as well with those illicit substances to show, as you kind of suggested, that there is a problem. So as you said, we don't really have a lot of data on who's vaping, so I can imagine that's hard as well. This is the last question we've got, unless anyone has any others. Is this applicable, is this process applicable, or like, can it be replicated with the multicultural communities, First Nation communities, CALD communities, or do you think different approaches should be applied? And I'll ask both of you to answer that as well.
Yes,
I think.
No, you go, Mel. You go, please.
I think we've done some initial consultation with CALD community, and our Aboriginal community is always involved with everything that we do. We've found that I think the same, just that really clear consultation, giving everyone access to speak their concerns and have the time to listen and going to people where they are. So we've been able to do some great consultation within our TAFE services where, you know, there's called English classrooms that we've been able to go in and actually meet the students where they are and the community members where they are and actually hear what their concerns are and being able to rank what the concerns are for that particular community as well. You know, vaping might not be the high priority, it might be something else. You know, there are huge concerns nationally around homelessness and, you know, isolation and that kind of thing. So I think we're really mindful of making sure that what we kind of work towards is actually what the community need is for every particular community. So yeah, it's a really, I think the importance of actually going in and talking to people at the ground level of what their concerns are and making sure that they're listened to and heard and treated with respect, I think is always going to be really pivotal to any work that we do.
Absolutely, Pete.
Yeah, well, thank you, Mel. I mean, that's spot on. And it's exactly what I was going to say, that each community needs to be treated separately, and that the real, like I mentioned it as a pillar of prevention, it needs to be a great focus on community engagement to identify the risk and protective factors that are relevant to the community, to gain the community support, and to identify the community champions. And yeah, it's just, no matter what the community, that's going to be important. But also just to highlight that there has been research in you know, First Nations communities, and in Australia we're actually leading in the way there, and there is some, you know, recognition of the sorts of things that do work, and it's involving community and the community mobilization and involving elders, etc. But yeah, what Mel said.
Amazing. That does bring us to time, so I'm sorry if I didn't get to everyone's questions. Thank you so much, Pete and Mel, for joining us and taking the time for such a wonderful presentation. I really look forward to the resource. I think it will be so helpful. Just a quick plug for upcoming NDARC webinars. So on the 13th of November, we have a harm reduction for Indigenous communities, research and emerging frameworks from Associate Professor Dennis Wendt. And then 20th of November, we have a webinar on examining gender in alcohol research, insights from a recent systematic review from Dr. Megan Cook and Dr. Sarah Callanan. So I hope you can join us all for those next events. And yeah, big thank you again to Pete and Mel. That was incredibly interesting. Have a fantastic rest of your day.